Many thanks for staying tuned. It's still the conversation here on Lagos Television. And today we're taking a look at a very important issue. And of course, oftentimes when you hear the word water, I guess the next thing that comes readily to mind is water is life. And also going by the, the wordings of late Fela Aníkúlápó Kuti, where he sang water, gets enemies. So today on the program, we're looking at water therapy, all of its benefits, all of its uses, and we also did ask yesterday, too much of water can also be dangerous. We have also realized, but of course the doctor will tell us why this is and what are some of those things that we need to take cognizance of when we're dealing with water. Some will tell you need to take certain amounts of water every day, and some will tell you, oh, at some particular age you might not necessarily need that amount of water. So what is the practice here, and what should we all look out for when it comes to water therapy? We have our doctor in the house this morning, Dr. Mohammed Isa. Thank you for being here on the program.
Thank you very much. Good morning.
So medically, please tell us, when we say water therapy, for wellness and for medical purposes, how important is water?
Thank you very much. Water is life, like you have just described it, because the human body is made up of 47 liters of fluid that flows, 47 liters. And out of these 47 liters, only 5 liters is blood. The remaining 42 liters is water.
Is water?
Yeah. So we're talking of 42 liters of water in the body. It means you must be able to maintain it. Otherwise, such a body will not function well. So example is that the body also divided into different compartments. You have what's called intracellular, extracellular compartments. So water flows in different pipes at different stages of the skin and the body system. So in different compartments, there are different type of content of the water in each of them. So sometimes when you're in the sun and you're exhausted on account of sun, it extracted and evaporates the salt part of your water in your body. And so when you come out of the sun, you're tired because that salt is what keeps your body functioning and give you hydration. Okay. Now, sometimes if you're vomiting and you're stooling and you're losing water, that one you're losing a lot of potassium and chlorine and bicarbonate. So that also gives you kind of a level of confusion at a point. You can begin to act like if you're mad because that's what the brain depends on solely, and then you have lost it. So all these compartments also maintain body, which depends on water solely. Okay. And that's why we say water is life, because every living thing, including rats and ants, lions and goats, humans, and plants, flowers and co, are living things. They are all created from water, and therefore you cannot survive without water.
Okay, Dr. Mohammed, how do we know the right quantity to take? Because Abimbola did say earlier that too much of anything is not good, including water. So how do we know the right amount of water to take? And then what are those signs that our body will show us or tell us that, okay, you are not drinking enough water or you're drinking too much of water?
Okay, now before we start talking of water intoxication, we can't be talking about intoxication in Nigeria because right now, by calculation, Nigerians do not have access to adequate water. So it's not likely that somebody will get into water intoxication. Water intoxication means when you take above what the body requires. Okay? And so we won't be talking of that in details because it's really going to happen.
Because there's shortage of water in Nigeria.
Okay, imagine if I go to eatery now, and pure water used to be 10 naira before, now it's 100 naira. So he's going to buy only one and drink. And if you ask him, he said it's okay. It's not okay. It's because he doesn't have extra money to buy extra water. So he just managed and go away and said, I'm okay with that one I've drunk. No, it's not true. So you can really get the water intoxication. Let's look into the water shortage. Now, when you do not take enough water in your body, you notice when you see the person, sometimes from the lip. For doctors, we're examining you, general examination. We look at your lip. The next thing, we look at your tongue. Or we check your eyes. From those three things, we'll discover whether you have enough water in your body or not. And that gives us a formula. We're going to calculate which type of water do you need to give back to you as a drip. Okay. Okay, so dehydration will show in your lip, in your face. Sometimes your eyes is sunken. It goes in, you're looking so like anxious. That means the water in your body is too low. Sometimes you're so tired. You sit down like this on the chair. The way you sit down, everybody will know that, this man is very tired. Give this man water, he'll come back to life. He replenishes his physical energy and performances. So you know from there that this person is tired. Or you cannot tell me someone who have been studying for like 2-3 days will have energy. No way, you cannot have energy because you have lost the minerals that gives you energy in the body. Or you talk to somebody who probably have been working in the sun from morning till evening on daily basis doing a hard job, and it comes out and tell you that I'm still energetic. It's not possible because the sun will have sucked out most of the content, water content in your body, and so you are dehydrated. Again, when you see people's skin that is flaky, dry, and clammy, evidence that such people don't take enough water. And such people are likely to grow wrinkle fast because the less water under the skin, the likelihood that the skin loses elasticity, and eventually it wrinkles fast, and then you can see, oh, this person is not taking enough water because the skin is so dry. So these are evidences to say. And then again, you go and pee. You go into the restroom, the water you can pee out is so little. It also means that what is in your body is too little.
Okay.
Because the quantity of water in your body also determines the amount of pee that comes out of you.
Wow.
So when your pee is small, it's too small, we call it oliguria, that tells you that, okay, something is wrong somewhere. Okay, you may have enough water in the body, there may be issue with kidney. Maybe the kidney itself is not even filtering the water well. So these are ways you'll be able to know that, am I really doing well in terms of water content? So we can now come to what should be the quantity one should take per day.
Right.
For our women, they should take about 2 liters to 3 liters per day, while like Mr. Ajibola should be taking like 3 to 4 liters per day. Okay.
Why is that disparate?
When you look at our bottled water now, how many should that be in a day?
Well, bottled water has to come about 75 cl, if I'm right.
Yeah.
So 75 cl, that's like a 2/3 of a liter. Okay, so you need like 2 of that make like 1.5 liters. So 4 of that give you 2 liters.
Okay.
Yeah, 6 of that will give you 3 liters. So that's how it goes. So in terms of quantity, that's what you need to take per day. And when we take of that, you need to take, we're not talking of the one you drink when you are eating.
That one is different.
It's different. We're talking of what you consume on a regular basis without even associated with food or anything you have eaten. So that means you need to sip water continuously every time because the body function depends solely on water content in your body. Like I told you, if man is made from water and 42% or 60% of body weight is made of water and 42 liters of water runs the body, then you cannot function effectively when the water in your body have actually reduced. Example, if the water in the body reduces about 3%, you begin to have what is called cognitive clog down. You're doing something, you get tired. Your brain just go off. You're tired in the brain. Not anything, because the water in your body is low. And so flow of oxygen and glucose to the brain is reduced. Therefore, you are doing something very tasking in the brain. You do like 2-3 minutes, you are lost in your sense. So you are beginning to think, oh, you are losing concentration. All of this can be a factor of water content in your body, as a matter of fact.
Wow. Now I think I have an idea of when you said we cannot suffer water intoxication in Nigeria.
No, it's not like
that is actually true, because I know that so many people do not even drink half of what you've talked about here today.
They can't even access it.
And then you're even saying it is minus what you should drink when you're eating. So it looks like everybody needs to go on water therapy. So there's this Japanese water therapy that says you should drink between 4 to 5 glasses of water on empty stomach every morning. Is that really ideal? Because some people will say they can't drink water on empty stomach.
You feel like they feel like they're vomiting.
Yeah, some will say I feel like vomiting, or why would I even drink water when I'm not eating anything? So is that a norm, or should that be a practice that we all should cultivate as humans?
Okay, I also want to sound this very clearly, because you just mentioned that, where do you call it now? Is it Japan?
It's Japanese water therapy.
You see, some of our doctors on so many platforms, all this question comes, there's one man in China that said this, there's one man in Japan that said this. We ask people to be careful that some of those things, you see, medicine in the world is divided into 2. Now, medicine in Asian country, they use different aspects of medicine to diagnose. While we in the English part, we use different to diagnose. So not everything they said that sometimes you have to take like that. Letter. So you need to ask your doctor, because we use blood to diagnose. They use nerve to diagnose. So they're 2 different things entirely. And that's why doctors cannot interpret some things that come from China, especially if they do some kind of test, or from Taiwan, or from Japan, or from any of these Asian countries. Because we use solely blood as a means of diagnosing what is wrong with you. So therefore, but universally, water is like what everyone should understand how to take it. So taking water on empty stomach is appropriate. There's nothing wrong with it. And the simple logic you have to understand is this. You have eaten in the night, you've gone to bed to sleep. Now, between night and morning, your stomach will generate more bacteria, because the remnant food that's there will be digested. So your intestine is filled up with gas. Okay. Now, if you want that to get clear, when you take water early morning, so the water runs through the stomach, through the intestine. And that means all the debris that were still hanging will flow down.
Okay.
So by the time you are going to the restroom, you are likely to empty almost 90% of the content of your intestine. So that gives you a healthy intestine
for
that day, yes. Okay. Because the journey between this mouth and the anus is too critical for you to understand. So the water you take washes all the debris and it gets it down to where it can actually come out as feces. Exactly. So it aids digestion, and when that happens, it assists you more to clear the intestine. Don't forget, it is this same intestine that's not well cleared, clog of feces and debris around the lower part of the colon, that people develop colon cancer, colon obstructions, because they really empty their intestine completely. Very rare. And it's because of quality of food they eat also. Those of the people that eat a lot of wheat, you can really empty your intestine. Yes, because wheat contains a lot of oil. So by the time you finish eating it, there's no way you'll be able to empty your intestine, except you take a lot of water. Similarly, you take beans. Beans, digested, generate full of gas inside your intestine. If you want to reduce that gas, before you start telling me, doctor, my stomach is talking, it's like drumming there. I said, okay, maybe some people are playing drum inside your tummy. So the only way to neutralize that immediately is take a large amount of water. It cleans it off, and your tummy will just go down naturally.
Wow.
Yes. Okay, still talking about timing. Abimbola mentioned morning. At night, what volume of water should we take?
Okay.
And aside from that, what are the other health benefits
of water?
Because I read somewhere that if you have cardiovascular disease or osteoarthritis or joint pain, water can actually assist in healing your pains.
Yeah, thank you very much. So when you talk of that of the night, that's the one we are different with the Asian people. They ask you to take large volume of water before going to bed. It's not true. Now, taking large amount of water going to bed, we all know that after taking water, in 45 minutes to 1 hour, you are likely to feel like going to pee.
Right.
Okay, if you take large amount of water in the night and you go to bed, so in 1 hour you went to pee, another 2 hours you went to pee, another 4 hours you went to pee.
Have a good sleep.
So that's the word. There's something called good sleep. What's the definition of good sleep? The sleep you have that runs about 8 hours without you standing up and waking up to do anything at all.
Doctor, 8 hours?
Yes. So by the time you wake up more than 2 times, then you have not achieved good sleep. Let me tell you, that's what we call random eye movement sleep. That's the stage where you enter the deep sleep that replenishes your body. And that occurs between 1 hour 45 minutes to 2 hours. So it means if you're waking up every 1 hour or 2 hours, you will never have entered into that REM sleep in each of your wake up. So you wake up in the morning, you are looking very tired. You say, I'm so tired. And you just wake up. It's because you never had good sleep. Okay? So that is very, very important. Again, in relation to cardiovascular, that's the reason why they ask them to take water in the night, because most people that develop stroke or have stroke in their sleep is an account of heart function. When the heart is failing, for those that have blood pressure, it needs flow of blood continuously. Now, the water you take regularly also assists blood flow and do not allow blood clot to stay in any part of the heart. So when you are at rest, blood flow is slower. And when you lie down now, the blood flow is slower, like when you are standing. So when you take a lot of water, it allows that flow to be maintained continuously. And so you can really develop stroke in sleep. Okay? So that's the main reason. But unfortunately, you're also not aware of the fact that you're waking up too frequently will eventually lead to high blood pressure in reverse. So that's why that will not go. So but when you talk of other aspects of health, benefits of water, let me pick it up from the beginning of our women today. Maybe, I don't know, but I want to do that. Weight management. Okay, a lot of times people say, that's why it has.
That's why you're fat.
It's not true. Now, you can actually use water to maintain your weight.
Wow.
Yes, if you want to really bring down your weight, you have to understand how to use water. So that means you take water more frequently than any other person. Okay, more frequently than any other person. And when you take volume that make you fill up. And that's why when you're going to eat, you're supposed to divide your tummy into 3, abstractly. Divide into first stage food, second one water, and the last one air. So when you fill the 3 stages with food, you see yourself, you are breathing like as if the food is in your chest. And you go to bed too early, you're in trouble, you roll from the right, and roll to the left, sleep is not going to come because the tummy is just not stable. So you don't take water in that manner. So for someone that wants to maintain weight, you take a regular water. The water you take makes your tummy full, and then you'll not be able to eat too much food. Okay. Eventually, your weight will die down. Yes. Again, it also assists in burning out the bad cholesterol in your body. The total cholesterol and the LDL cholesterol, these are the major two cholesterol, apart from the remaining three, that are good for the body. These two are usually common in the food we eat around. And most people that have hypertension, they always have these two high. So if you want to burn those two bad cholesterol, you need a lot of water. So that when you engage in activities, the little sweat you do, you're actually boiling and then you are melting those type of fat to get out of your body. So your heart is free. So your blood pressure will go down on account of your water you take. So you can see. Similarly, in the human body, we have over 300 joints, about 360 joints in our body. All these joints, in between each of them, there's water. Now, if you want to live a healthy life, you need water to maintain those water in those locations. That means you must be taking water to lubricate the joint. Otherwise, when the water there is too low, each joint will touch each other and they start giving you pain. That's what happens in arthritis and the like. So if I hit my knee on this wall now, I begin to feel pain because the water there will be inflamed. So that's why sometimes we drain the water away from joint. And sometimes we inject even the joint with some drug to actually relieve the pain, to neutralize inflammation in that location. We are actually producing water to neutralize those joint pain. So it goes on and on. You want to have a fresh skin, you need to have a lot of water with you. So for people that want to look healthy with your skin, you don't need all those names of the creams you need in this world. Eat good food and take a lot of water. You always look radiant and as if you are using one special cream. There's nothing like that.
It's water cream.
It's water cream. So it goes on and on. Then again, look at your kidney. For those listening to us at home, you remember your pumping machine, the one you put in the ground that suck water from the ground to the up. The same thing, our kidney function. Now, the more kidney receives a lot of water in the body, the more the kidney pray for the owner. Why? Once the water in the body is too low, kidney begins to suffer its activity. So if your submersible machine in the ground is the pipe is not getting to water, what does it suck? It sucks sand and air. Right. And before you know that machine will pack up. So if your kidney is not receiving enough water in your body, it's not getting to it, the kidney will soon pack up. And before it pack up, you can develop what is called kidney stones. Now, if you want to prevent your kidney going down, or you want to prevent kidney stone, you need a lot of water that runs in your body continuously. And when that happens, you cannot form stones in your bladder, you cannot form stones in your kidney, you cannot form stones in your ureter, and that's saving. A lot of people today, I have just about a 32-year-old lady who want to get married and is bedwetting, and all they have done is all the rituals of this what have been done, only to find out that she has a stone in the bladder at the junction where the ureter empty into the bladder. There's a stone there. So when when the urine filled up, she's not aware. So if a 32-year-old person, she dated first, I've rejected her. Secondly, I've rejected her. So she's the third person and she's afraid. Now wants to discover again that she's bedwetting. So she's trying to manage bedwetting. Only to discover the stone, and we're able to remove the stone without even a surgery. And today she's not bedwetting again. So stone can be a factor on account of poor water intake. And you begin to go heaven and earth to look for a solution because you don't take enough water. Right. In fact, you cannot live in the northern part, Maiduguri especially, without taking water. You will soon die because the weather, because it dry you off in hours. Even you're inside your house, it dry you off, not talk of being outside. Wow. Yes.
So, I mean, all of these things that you've talked about this morning are ways of taking in water and all of the benefits that you've talked about here. But are there also external water therapy?
Yes, definitely. We talk of thermoregulation in terms of now when you have taken some water and then you do some activity, you sweat. The water in your body that is there is what is coming out. Okay. Now, if those water comes out, it regulates your temperature. Now, it's expected that at the end of this your sweat, you should go and shower this your body. Okay. Otherwise, those ones that dry your skin will block the pores of your skin. Very soon you develop some rash or some AO in some part of your body, because the hole on the skin is blocked on account of dirtiness. So now taking bath regularly or using soap to bath the body is also a means of replenishing the body, because the water soaks into the body. Example, if you put your baby or your 1-year baby inside a pool of water, that baby will increase in weight, because the skin of a baby is so porous so it goes into the baby. The baby will look bigger when you bring the baby out. Similarly, if you go and stay inside the swimming pool as an adult for long, you're going to add a little weight because the water will have percolated through your skin into your body system. Wow. So because there are a lot of holes on our skin that traverse water in and out. So there's external way of maintaining good health by using water to actually wash your body. This is also very important.
Okay, still talking about external now. You mentioned swimming pool, and I'm also aware that one can have hot or cold bath. Do we need medical advice or medical check before we decide on which one to do, so that there won't be stories at the end of the day?
Okay, the issue is that some people say that don't use hot water to bath because it's going to spoil your skin. Some will say that don't take cold water to bath because it's going to make your skin to be thick.
And some will tell you to start from your leg where you want to use water.
Yes, that's another Asian medicine. When that one was in the air, I got a lot of calls for that. Those that have stroke, when they enter the bathroom, that's when they have stroke. That when they want to bath because they pour water on their head, and that's why they develop stroke. I said it's not true. You now tell them that you start washing your leg
first, so that your body will regularize with the water before it comes to your head.
And I said, ask those your Asian doctors again that when we talk of aseptic procedure in medicine, or when we talk of proper hygiene in medicine, there's a principle. The principle says wash from the higher part to the lower part if you want to maintain good health. That's law. That's medical thing. You can't wash this face before you wash this place. You wash here before you wash here. So, and that's the principle. So if you start washing your leg, you are actually transferring more dirt up, because dirt is supposed to come down. It's not supposed to be transferring up. So that's not even the right thing. So in terms of water use, you don't need any doctor to actually tell you that. It's about you. Some of us can tolerate cold water even to any extent. You're sitting in America in about -10. You're ready to bath with cold water. Fine for you, it's okay. But if you are there and you cannot bath with cold water, please use warm water. You are in Nigeria of temperature of 27 or maybe 38 degrees and you still want to bath, take warm water to bath your body. Warm water actually opens the skin more than cold water, okay? So if you really want your skin to be more freshening and more cleaner, warm water, not hot water. I think we should get the warm water. A water you can actually drink is what we are referring to, not the water you can use to actually do your momo and your shower. so you're talking of water that can actually, you can drink it naturally. So that's what you bath with. That cleans the skin more, because you should also understand, when you take your bath and you put your hand on your ear, sometimes you notice the ear is oily. So that tells you that the oil actually is blocking some part of our skin. So water that makes those oil to go easily is warm water. It takes away all the oil part of the skin. And our face is usually oily. So when you take warm water, it cleans the face more cleaner and then reduce the amount of rashes you've had on your face. So that also goes a long way.
Does that also translate to some people that will say they prefer to drink warm water than to drink cold water?
Of course, it's better to drink normal temperature water.
Room temperature.
Room temperature. That's the best water. But if at all you are sick or you need any reason, then take the one that's warm. Don't forget that when the weather is very hot, Nigerians take cold water.
Yes,
which is the reverse.
It should be the reverse.
For those that understand very well, they take warm water, even in the hot season, because that's the kind of water that the body will now make use of to rehydrate your body. When you take cold water, in less than 30 minutes, you are thirsty again. When you take warm water, in another 2 hours, you're not thirsty, you're not tired. Because the warm water is going to be converted to what the body needs and penetrate every part of the compartment I told you. I said we have intracellular, we have extracellular, we have other compartments that the body has. So all the water will get there when you drink warm water in normal water. It gets to every compartment and you'll be healthy and energetic. When you drink cold water, it stays in only one compartment and gives you a feeling of satisfaction. You know, Nigerians and human beings naturally think that it's sweet, we like it more and more dangerous to us. Now, I can't give you banana, plantain now and say they give you plantain. Most likely you're likely to fry the plantain, whereas you're eating rubbish. Instead of it to have boiled the plantain that get the best value. But because the fried one is more sweet, so you're likely to prefer the fried one. I give you meat, you want to fry the meat before you eat it, you're eating rubbish. Rather than cooking the meat or boil the meat and eat it, which gives you the more nutrient in the body. So things that look more convenient, you watch out very well, is usually more dangerous to the body.
Wow. Okay, is it a fact or a myth that there is a strong connection between blood pressure and water?
Yes, there's a connection. Like I told you, if your body is having 42 liters of water and you have 5 liters of blood, so that's 47 liters of what is running in the body continuously. In blood pressure, the amount of blood getting to the heart is too much. So the heart is receiving what is too much for it. So the heart begins to enlarge to accommodate the content that's coming in. Now, those blood become thickened on account of blood pressure, become thicker than normal. So when you take a lot of water and you have a lot of water in your body, it neutralizes the blood. So the mixture of blood and water there will balance and form something lighter to move freely. You see, what kills high blood pressure people is clotted blood. Small clotted blood, like a tip of a pen. That's all. You just be moving, get to any part of the body and block it, trouble bursts.
Oh.
So then when there's a lot of water in the body, it flows easily and the blood becomes lighter to move through the veins and artery. Don't forget also in high blood pressure, your arteries and veins are now thick. They are like a pipe that have been burned with fire. So movement in it is very, very difficult. So you need a blood that is lighter, that flow easily. And that's why we place them on aspirin to make sure that the blood is thin and the blood can flow easily. So water also assists in doing that to make the blood also neutralize and flow very well.
Right. I know that while growing up, we used to hear a lot about you know, our grandmothers and mothers say something like, maybe you should try some Epsom salt bath for different reasons. Are these things required? Do you need to add anything in your water before you take your bath, or do you need to the Epsom salt, is it necessary? Well,
you remember in Ebola, that's what people were doing. Pouring plenty of salt inside their water. And drinking a lot of water that has salt, and they end up dying on account of salt intoxication.
Right.
So that's not necessary.
Okay.
But our pharmaceutical doing antiseptic solutions have made it easy. So you have your antiseptic, you put some drop in the water.
Okay.
Is to actually allow that to also kill external germs.
Right.
So the ordinary water, I said, the warm one is very good. So you now put a little one drop or one of the antiseptic liquids, which neutralizes with the water. So when you bath with such water, those kind of antiseptic also kill germs that were on the skin.
Okay.
Not salt. Salt in our body is already enough. So when you now use salt to bath, it goes into the skin, you destroy your skin.
Okay.
And if for any reason it gets too much, your blood pressure will be high. So why do you want to kill yourself gradually without you knowing the right thing, all in the name of copying somebody?
Right.
Somebody is bathing with salt and you want to bath with salt. No, it doesn't go that way.
Okay.
Some people have done that and they run into trouble. So the other one that our women are doing now is mint leaf, putting mint leaf inside water to bath.
And lemon.
Yes,
so, and lemon.
And cucumber. And
so they want to have
spiced water.
They want to have good skin, whatever. So well, it's left for them for those that compound the agbo for them. I don't know.
So is an agbo?
As far as I'm concerned, it's an agbo.
So, doctor,
you know, some people find
I mean, to take ordinary water.
Ordinary water.
In terms of drinking?
Yes.
Yeah. Oh, in terms of drinking, you can, that one we call it fortification.
Okay, so you can have
now,
lemon.
You can actually put a drop of honey inside your water to make you drink more.
Lemon, lime.
Put the lemon, a little, provide it down for ulcer, so they can take more. Yes, it's allowed. But when you now put honey, cucumber, carrot, lemon, and the mint leaf inside your water and begin to bath and be scrubbing your body with it, I
that one calls for.
You're actually bathing rituals. So.
No, they say it's detoxification.
Oh, okay. Detoxification of the skin.
Of the skin.
Oh, okay.
Okay, I've seen some things online where people will soak themselves inside
water tubs.
Not water salts, ice blocks.
Bath. Oh,
ice blocks. Okay. So to achieve what now?
They say it's beneficial to the body.
Like some will do the sauna bath.
Okay, which is warm.
Warm, yeah.
Yes.
And like you emphasize, they should actually be warm and not hot.
Not hot.
Because some will tell you that they want to have steam bath.
Yes.
And they're actually steaming their bodies,
yes.
Replenishing which lusts I really don't know.
No,
so medically, it's best you do the warm and not hot.
Or normal water.
Or normal water.
Yes. And you see, most of the sauna people, you can see most of them, sometimes they're actually trying to bleach the skin, because that's what I see, because they've applied something on the skin before they enter into the warm, so that actually peel off the external layer of the skin, and they want to look different colors. So that's for those that are using cold one, I think they should be very careful, because they can actually freeze up at the dye. Because when you're inside cold, it actually constricts your blood vessels. Blood vessels now become constricted, blood flow to the body becomes stagnated. So such people can develop a clot blood, and they can actually they can even die on the spot, because you have what is called a cold that leads to death because on account of freezing. Right. So people get frozen inside a frozen bite and then they die. So lying down inside the ice block, I wouldn't know what is actually
what the
going in their mind.
is.
So I don't know that actually. I don't know about that, sir.
Right. But doctor, how can people find help? Because there's some people who ordinarily do not like drinking water. Some will even tell you that, I think earlier we mentioned the fact, some will tell you that if they drink water, either any time they want to puke, they just can't stand the taste of water. And I think that's why sometimes some people drink, there's what they call this water, sorry? Infused water. There's just something that they add in their water because they can't just stick taking ordinary water in their mouth. So what's your advice to people like that, and how much effort should we all make to ensure that at least in a day we get the required amount of water into our bodies, and also when you're dealing with children? Okay,
children, I'll pick it from there. They are very important in terms of this water issue we are discussing, because when you go to any general hospital, I speak with you, you go to children emergency, you meet so many children and babies who are dehydrated on account of vomiting and stooling. It's so fast, because when they stool or vomit twice, they are dry. They lose that water very fast. So please, as a warning to mothers or young mothers at home, your child has vomited once or twice or stooled once or twice, and you are using your ORT, you have used it one or twice and it's not stopping, please move straight to the hospital. Okay. The ORT is not to stop the vomiting and stooling, it's to replace the vomiting and stooling that he has done. So for children, let's be very careful. That is not even no-go area compromising the kind of water they should take. They should always take enough water on daily basis. Now for adults that you don't like taking water, you need to learn how to take water. I will tell you about myself. I once visited Maiduguri for some years, and I don't like taking water. So when I got there, the first few weeks, I realized that I'm always tired. I'm always in the hospital complaining that I'm having pain. And I realized that each time I go to use the restroom, the urine is like red, almost becoming blood. So I was asking myself, do I have infection or have any liver or kidney disease? No, until I met a doctor, and the doctor said, how much water have you taken? I said, no. I said, wow, how are you surviving in this environment and you're taking not enough water? I said, I don't like it water. So he said, okay, what you can do is that basically for those that don't like taking a lot of water, you must learn to have other things you can mix without water. Okay. That you like. Like I mentioned honey the other time, many of us like honey. So put some quantity of honey in that water and shake it together. It changes the color, it changes the odor, and then it gives you some taste. Yes, it gives you some taste, and it goes. That's what children do. When you see all the ORT we do, now they are doing ORT that is like sweet, that has color, have fragrance, so that it attracts them to be able to take it, because the original one is so repulsive. You take it, right, it makes you feel like vomiting. So now children can take it more of that because they've actually fortified it with some colorant and some preservatives. So now for adults who don't like taking water, you must get to know something like, is it lemon, is it honey, is it any other thing, like, okay, this so-called vitamin C that is dispersible. You can actually put that also in the water. It disperses immediately and changes the color of the water, and you'll be able to take more. Please try to take a lot of water. It helps your life.
What about tea and coffee? Do they make up for water?
I was going to say that because we have a particular colleague here. He doesn't like taking water, and his own water is tea.
So can they make up tea and water?
They don't make up coffee. Let me explain to you. Now for what you call tea, I don't know what you're referring to tea. Give me an example of tea.
Maybe Lipton.
The tea bag, and then of course coffee.
Thank God we got it here, because Nigerian will tell me that I drank tea, drank Milo. I said
no, that's beverage.
So that one is food. We call it food drink. It's not tea. So when you take your tea, either the black tea or white tea or green tea or Poyara tea, whichever of the tea, we have about 7 types of tea you take. Now, this tea is processed in the body differently from ordinary water. Okay. And you must get this fact that it doesn't replace water. Now, those that take Lipton or that take some of this tea that contains, you have to be careful, because some of them contains caffeine. Now, recently we have a man that is always jittery, and then people are saying, we don't know what's happening, maybe they want to kill him. He's always jittery. It's like this. And we found out that because he took so much Lipton of his life, and we asked him to stop it for like 2 months, and in the normal body comes back to normal. Similarly, if you take a lot of coffee and it becomes too much, you notice at the point your hand begins to shake, because it is too much. It's not ordinary water. It contains caffeine. That caffeine is depositing in your brain, depositing in your tissue, and then begin to activate you. It gives you a lot of energy, of course. You are able to do everything without you getting tired. No problem with that. But at the end of the day, you pay back for it. Because that make you...
You're puncturing me.
No, does that make you not able to sleep well and start looking for a drug to sleep? or it makes you to become restless and begin to look for drugs to make you have rest, or it makes you uncomfortable because the caffeine in the body is too much. So you can't compare tea, coffee with ordinary water. They are never the same.
So water.
Yes, water is water. It's different from any other thing. Apart from fortification of those things we mentioned, like honey, which is ordinary, or we talk of vitamin C, or we talk of lemon, those are ordinary, they're fortification.
Okay.
That one still work with the water because it mixes with the water directly. But unlike your tea, they are different entities. You're only using water to propagate the caffeine into your body.
Okay.
You don't understand now? You're using the water to propagate caffeine. So we are actually drinking caffeine.
And no water.
No water.
Okay.
Okay, doctor, I'm sorry,
Go
Abimbola.
ahead.
Let's talk about water and exercise.
Good.
So, should we take it after or during?
You take it before.
Before?
Yeah. When you take it before and you do the exercise, you sweat. In fact, you actually, that's the real detoxification that people should hear now.
Okay.
That's the real detoxification. Now you've taken the water, the stomach is filled with water, and it needs to be absorbed into your tissue. Your exercise will fasten the rate at which the water is distributed in the body. And you sweat, it means every tissue in the body has received water, and they will sweat out all their disease. So your body is more detoxified when you take water before you exercise. And then by the time you are done with exercise, you now take a little to complete it. You have done excellently well for yourself.
Okay.
So that's how to take water in terms of the exercise. So take your water before you start your exercise.
All right, we'll probably have to leave this conversation here this morning. I guess we've all picked one or two things from this conversation this morning. Everyone needs to get to, the habit of drinking water daily. I know a lot of people, will be in this category of not drinking enough water, but we've all heard it from the doctor this morning. We must be intentional. You heard me say we, because I also fall into the category of those that are probably not having enough water at the moment. It takes a whole lot really to drink water. I really don't like drinking water. I probably will make do with coffee rather than water. But I think today I've learned that
coffee is not water.
I'm doing myself a great deal of disservice, and so I have to probably also continue to take more water. My children always even tell me, "Mommy, you're not drinking water." They drink water than I do. So we all need to make a conscious effort at ensuring that we drink more water. Again, thank you so much, Dr. Issa, for finding time to be here on the program today.
Thank you very much.
We'll take a quick break. When the conversation returns, Joy and her guest will take you through their Lagos conversation today.